Advocate had some unique problems that were driven, first of all, by just basic communications. The phone system stunk. There were so many different phone systems, the physicians were having a fit. No single voicemail, no way to move from clinic to clinic or healthcare facility to healthcare facility with any ways of using common tools. All the staff didn't know how to use any of that, and so one of the biggest drivers was fix that. And how they fixed it was to actually overlay a voice system that was based on the wide area network of the healthcare system in Chicago, tie all of that together. This is a very simple step. It wasn't a clinical step, it was a workflow step. And from that, the physicians had single voicemail. They were able to move from hospital to clinic to hospital, single voicemail. The phones had small little QWERTY keyboards in them. You could dial departments by name and people by function. And then began integrating all of the other functions in the hospital into the comms infrastructure. Coding systems, paging systems, nurse call systems, emerging gateways for IV infusion pump alerts. So this was backing into it. Again, we sort of backed into it as a need rather than taking it from the top down as a strategy. But because of that, and because of the clinical guidance of Gary Horn, who leads the network effort at Advocate Healthcare, they began to get clinical input that now said, what else can we do with the system now that we have it? So they put in a trial with 100 users of a collaboration tool that we call My Teamwork. It lets you share voice, video, data, and collaborate in real time, build buddy lists. You know what the main purpose of it was to reduce travel time throughout the Chicago area. But that little 100-person trial turned into 9,000 end users lining up for it. So now it turned into a clinical consultation tool. It's embedded into their intranet pages so that every department has a buddy list of who's available. On the clinical side, it shows who the consulting surgical residents are, the consulting specialists are, and where they are, even when they log in with a mobile device. So this is Advocate taking it from